Okay, so diagnosis. Okay, sounding like kidney,
Okay.
nephritic versus nephrotic syndromes.
Okay.
Okay, so we got a 28-year-old woman, one week history of hematuria, edema, and hypertension, elevated serum creatinine, red blood cell casts. So it's sounding kind of nephritic, unless there's protein coming on later. Crescent formation of most glomeruli, a linear deposition of IgG along the glomerular base membrane. Okay, so it's a nephritic syndrome. You're having blood, not protein, that you're paying out. It's a 28-year-old female, so you're thinking along the lines of autoimmune is likely. The linear deposition of IgG. Um, so minimal change disease, you can get rid of that. That's mostly in pediatric populations, and you're not going to see anything on histology. Um, I don't think it's MNGN,
Okay.
membrana proliferative. I don't think it's IgA nephropathy because it tells you it's IgGs along the basement membrane. And I don't think it's Hinach purpurea. I'm not as familiar as I'm thinking back, but it doesn't describe any skin findings, which I think you need if you're going to have purpura. And
Mm-hmm.
and I know good pasture is linear compared to a granular deposition, so I'd go with that.
Okay, good. Yeah. So one of the key things is right. It's going to be this, glomerular membrane, and then basement membrane, alveolar membrane, right? And then it
Mhm.
can lead to rapidly progressive glomerulonephritis and pulmonary hemorrhage. Just kind of remember that. And that's the key with the crescent. Anytime you see crescent formation in the granuli, you got to be thinking rapidly progressive glomerulonephritis. Okay. Membranous proliferative glomerulonephritis. It's a mix. Usually you have some protein in
Mhm.
there. Hinox Sloan is usually so these two clinically, right? Hinox Sloan purpura, right? Usually you get GI symptoms, diarrhea after like a viral infection, and then one of the key things is you have palpable purpura, kind
Mhm.
of on your legs and your abdomen area,
Okay.
seen in a lot of PEDS patients. You can have some renal issues too, but mainly those are going to be your key symptoms. IgA nephropathy, right? This is going to be kind of your inciting factor disease, is kind of what I classify it as. But you have a viral infection, you get sick, and then you start peeing out blood. Likely that's an IgA nephropathy, but they have to give you that you were, you had the flu or you had bacterial infection, something before, like, and then you have that. But minimal change, right? Pediatric patient, you're going to pee out a bunch of blood, and then you have the podocytes on the electron microscopy issues. So
Mhm. Yeah, but if you do like a biopsy or anything like that, you wouldn't see anything for minimal change. That's one of the key factors I remember there.
perfect.